Uh, what do you think, and this is for anyone, what do you think is important about HIMSS hosting a Most Influential Women in Health IT award? And for those of you who won the award or who are awardees, what does it mean to you personally?
Actually, I was my fellow workers at the hospital. They created a card for me, and one of them wrote that we always congratulate each other on our successes, and I always find it meaningless. But this is the first time that I congratulate someone, and I feel that I'm really congratulating someone. And the thing that made me happy when I received that award is that, or no, not happy. The thing that made me accept it and understand it was that I accepted it for all women in Saudi Arabia. It's not just personal and only for me. It really recognizes all their efforts. I really felt the impact of this award. So, yep. Yeah.
What about you, Christina?
And really very humbled about all the amazing women in this industry who have really helped lift me up. Marion, you said something earlier that it's often men that have helped us along the way, and that's true for me. And I say, I guess I'm one of the younger ones in this group, and I've had some really bad experiences along the way with women in the field. I was originally trying to get into communications, and I remember submitting my resume to a firm that the boss just didn't want me in there because of the recommendation. It was never put in, and I was told that by my person that recommended me that I wasn't interested. I was very interested. I also was told my resume was submitted to another company that I really wanted to work for and was really excited about just coming to Washington. And the woman felt threatened by me. So again, it wasn't submitted. So at that point, I said to myself, well, this is dumb. I'm not going into this. I'm not doing this. So it's when I decided to get my MBA. And I thought to myself, well, if I shocked a lot of people when I decided to go into MBA. But my thought behind it was, well, I don't like the way the world is working. So I'm going to insert myself in the middle of it and change it. I also, as I got into my career, I'm lucky because my dad goes to work every day and he's excited. And I always said to myself, that's what I want. I want to do something that I'm really excited about. So I started studying more healthcare. I've always loved health. I wanted to be a nutritionist at one point. I really didn't know my path, very not linear. And the science was a little just not what I wanted to do. But I always knew I wanted to go in healthcare. So I actually created my own degree at George Washington University. I went to both the MBA school and the health services school, and I said I wanted a minor, and they told me that I was, it didn't exist, and it was really about funding for the school. And I told them that the amount I was paying, it was going to exist. And so I am honorary in the program under the Health Services Management and Leadership, because I really just wanted to go into health information technology. But it's been an endless battle the whole way, really. I think along the way, I've found that by surrounding yourself with women who think like you and want to encourage you instead of those that want to put you down or feel threatened by you, you get so much further. And I just love the women I've met in this field, and I feel blessed to have so many amazing mentors. I've also started opening my eyes to the why other women feel threatened, and trying to understand that and reaching out to those women and saying, well, let's shift this attitude. I mean, and I think that's really important for us all to do as a community.